Imagine the 16th century, a battlefield, the groans of the wounded. Physicians, if they could even be called that, adhered to ancient dogmas. Wounds were treated with boiling oil. Suppurating limbs were amputated without anesthesia. The chances of survival were almost non-existent. It was into this world, where medicine was torture rather than healing, that a man arrived who changed everything. He was a simple barber, self-taught, without a university education or a renowned name. He did what seemed unimaginable. He abandoned barbaric methods, replacing red-hot irons with gentle balms, limb amputation with the ligation of vessels, and outdated dogmas with experience and logic. He invented new instruments, constructed the first prostheses, and created an atlas of anatomy. Ultimately, he became the personal surgeon to 4 French kings, and his works laid the foundation for modern surgery. Something incredible happened with him. He didn't just treat people. He revolutionized the understanding of medicine's possibilities. His name was Ambroise Paré. His story is not a fairy tale of sudden enlightenment or a brilliant discovery made in the quiet of a study. It is a testament to how practical experience, keen observation, and the courage to defy established norms can lead to a revolution. Scientific breakthroughs rarely occur in a vacuum. More often, they are born out of acute necessity, despair, and a willingness to act despite convention when old rules cease to work. 16th century medical practice was not merely backward. It was a prison built from dogmas and centuries of misconceptions. Its foundation rested on the works of Galen, a Roman physician whose theories on the 4 humors, blood, phlegm, yellow bile, and black bile, remained sacrosanct for nearly 1,500 years. Any illness or suffering was attributed to an imbalance of these humors. Treatment involved attempts to restore this equilibrium through bloodletting, emetics, and purgatives, which debilitated the patient but never addressed the true cause of the ailment. Surgery, meanwhile, was considered a lowly craft. It was performed not by learned doctors from universities, but by barber-surgeons, butchers, and bath attendants, individuals forbidden even to touch internal organs. Their world was one of open wounds and fractures, governed by equally brutal rules. Chief among these was the belief that a wound had to mature, meaning to suppurate. This whitish, foul-smelling fluid was called the laudable pus, considered a sign of cleansing and proper healing. In reality, it was a sure path to sepsis, gangrene, and agonizing death. To burn out poison from a wound and stop bleeding, red-hot irons or boiling oil were used, methods that inflicted unbearable pain and only exacerbated shock. Most patients who survived this torment died from subsequent complications. This was a world where suffering was considered normal, and death an inevitable outcome for most patients, a world where knowledge was not tested by experience but blindly copied from ancient treatises. To change it required not just a new discovery, but a complete reevaluation of everything that had been believed for centuries. It was at this time, in the early 16th century, that Ambroise Paré entered the scene. He was not a university scholar. He did not wear a doctor's gown. His path began differently. The son of a simple carpenter from the small town of Bourg-Hersent, Paré lacked the means for formal education. His teachers were his craft in the streets. At 15, he became an apprentice barber in the provinces, where he learned the basics of shaving, haircutting, and, of course, bloodletting. This was common practice at the time. Barbers performed simple medical procedures. But Ambroise wanted more. Around the age of 19, he arrived in Paris. The city was a hub of science and superstition, luxury and poverty. Here, in the very heart of medical orthodoxy, Paré secured a position at the Hôtel Dieu hospital. This was not a hospital in the modern sense. It was more like a holding place for the dying. Dozens, sometimes hundreds, of sick individuals lay on straw mats, 2 or 3 to a single bed. Infections spread instantly. The air was thick with the stench of pus, blood, and fear. Amidst the groans and despair, Paré spent 3 years. He did not study ancient treatises or memorize Latin. He observed. Every day he watched as physicians applied boiling oil to wounds, cauterized with red-hot irons, and amputated limbs without the slightest pain relief. He saw patients who survived this torture die from shock or subsequent infection. He was told that pus was a laudable phenomenon, a sign of cleansing. But Paré saw something different. Pus was a harbinger of death. He saw that the methods taught as dogma did not work. They killed. This harsh, uncompromising reality became his true university. He could not accept the suffering that to him seemed caused not by illness, but by ignorance. His hands worked, but his mind constantly sought answers. Why did some methods bring relief while others only aggravated pain? Why did patients who luckily avoided cauterization sometimes survive, while those treated by all the rules died? It was this daily experience, this constant confrontation with the inefficiency and cruelty of traditional medicine, that planted the seeds of doubt in him. He began to trust his own eyes more than ancient books. Trusting his own eyes rather than outdated dogmas soon led Paré to the battlefield. In 1537, he obtained a position as a field surgeon in the army of General René de Montjoie. War was a harsh teacher. Gunshot wounds, which had only appeared a century earlier, were considered poisoned and required immediate cauterization. This was a rule carved in stone. The siege of Vilaine during the Piedmont campaign became a true test for Paré. The battle was bloody, with dozens of soldiers suffering horrific wounds brought to the surgeons. Paré worked incessantly, cauterizing wounds with boiling elderberry oil, as tradition demanded. As day turned to evening, the number of wounded grew. Then something happened that became a turning point in his career and in the history of surgery. The boiling oil ran out. Despair seized Paré. How could he treat the remaining soldiers if the primary instrument of torture, which also served as treatment, was exhausted? According to all the rules, without cauterization, the wounds would fester and the soldiers would die. But his experience at Hôtel Dieu suggested otherwise. He had seen how those who were cauterized suffered, and how sometimes those who, for some reason, managed to avoid this agonizing procedure survived. Driven by desperation and a bold hunch, Paré decided on an unprecedented experiment. Instead of oil, he prepared a balm. He mixed egg yolk, rose oil, and a little turpentine, ingredients that, according to old folk remedies, were used to treat skin inflammations. Carefully, without haste, he applied this soft mixture to the open wounds of the soldiers for whom there was no oil left. The others, fortunately, had already been treated in the traditional manner. Paré spent the night in anguish. He did not close his eyes, tormented by doubts. What if his experiment led to death? What if, the next morning, he found even more suffering than usual? He feared his bold decision would turn into a catastrophe. Dawn broke. With the first rays of sunlight, Paré rushed to the wounded. What he saw profoundly shocked him. Soldiers whose wounds had been cauterized with boiling oil writhed in pain. Their faces were contorted, limbs swollen, and burned skin inflamed. They groaned, their fever evident. But a different scene awaited him at the bedsides of the soldiers treated with his balm. These men slept peacefully. Their wounds were clean, with no signs of inflammation or blackening. The skin around the wounds looked healthy. They did not experience the unbearable agony that was the norm for all who underwent cauterization. This was a moment of epiphany. Not a loud explosion, but a quiet yet undeniable truth revealed to his eyes. He didn't just find an alternative. He understood that the old method, accepted for centuries, not only failed to help, but caused unbearable harm. He realized that the so-called laudable pus was not a sign of cleansing, but a symptom of infection caused by barbaric intervention. That morning, Paré understood. Treatment should be relief, not torture. Healing, not destruction. He saw that gentleness and cleanliness could save lives where cruelty only multiplied suffering. This experience, gained directly on the battlefield, became the first but most crucial step toward a revolution in surgery. He proved that observation and logic surpass blind faith in ancient dogmas. After that dawn at Vilaine, Ambroise Paré never again used boiling oil for wounds. He didn't just abandon a method, he re-engineered his thinking. He understood. Truth lay not in old books, but in results, in what he saw with his own eyes. This was his empirical method in action. Observe, try, evaluate, then change. He applied this principle to everything. Having rejected cauterization, Paré faced a new problem. How to stop bleeding without amputating a limb. He observed again. He recalled how veins were tied off during bloodletting. He dared to apply this technique to large arteries severed on the battlefield. This was a revolution. The tying, or ligature, of vessels instead of brutal cauterization or amputation. This required new instruments. He needed forceps to grasp the vessel, needles to pass the thread. He created and refined them himself, working alongside blacksmiths and artisans. His compassion knew no bounds. He saw soldiers returning from war as cripples, and so he began to create the first functional prostheses. Not just wooden stumps, but complex mechanisms with hinges that allowed for at least partial restoration of lost functions. These prostheses, centuries ahead of modern developments, were a direct result of his ability to see a problem and seek a practical solution, unconstrained by tradition. But experience alone was not enough. Knowledge had to spread. Paré understood that the academic world spoke Latin. Yet he himself was a barber-surgeon, a man of the people, without a university education. He made an unprecedented decision to publish his works in his native French. This was a defiance of centuries-old tradition, a barrier between scholars and practitioners. His books, written in simple, understandable language, opened his discoveries to thousands of practicing physicians and barber-surgeons who did not know Latin. He made knowledge accessible, democratizing it. His path was one of constant experimentation and revision. Whenever an old method failed, Paré didn't seek excuses. He sought a new solution. He wasn't afraid to admit mistakes, neither his own nor those embedded for centuries before him. It was precisely his background, the absence of university dogmas, daily hands-on work, direct confrontation with pain and death, that gave him a unique advantage. He was not tied to theories that didn't work in practice. He was free to think differently. His authority was not a diploma, but saved lives. Thus, step by step, relying on what he saw and what worked, Ambroise Paré dismantled old medicine. He built a new one, based on observation, logic, and compassion. He showed that true breakthroughs begin not with brilliant insights, but with a willingness to discard old beliefs for the sake of real results. This was the foundation of modern surgery. Yet every breakthrough, every bold idea that challenges established norms, generates not only followers, but also fierce opponents. Ambroise Paré, the self-taught barber-surgeon whose hands saved lives where learned medicine only multiplied suffering, became a direct threat to the entire medical establishment of the 16th century. The Paris Faculty of Medicine, a bastion of centuries-old traditions and dogmas, could not tolerate such an infringement on its authority. Learned doctors, clad in robes, proudly displaying diplomas earned after years of studying Latin and ancient treatises, looked upon Paré with contempt. He was not one of them. He didn't know Greek, nor did he quote Galen by heart. He was a craftsman, an ignorant man, a charlatan, who dared not only to treat, but also to write about his methods, and not just write, but publish his works in vulgar, common French, an unheard-of audacity that made their secret knowledge accessible to commoners. Their accusations were sharp and numerous. Paré impinged upon sacred principles. He refused cauterization, which, in their conviction, burned poison out of wounds. He ligated arteries instead of cauterizing them or amputating limbs, which was considered dangerous and impure. He questioned laudable pus, calling it a sign of disease, not purification. This was not merely a difference of opinion. It was a direct assault on their professional identity, on the very foundation of their world. The faculty repeatedly tried to ban his practice, declare his methods dangerous, and label his books heretical. They wrote angry petitions, spread defamatory rumors, and attempted to strip him of his right to operate in Paris. To them, Paré was not just a competitor, but a destroyer, a man whose practical success demonstrated the emptiness of their millennia-old dogmas. But Paré had powerful protection. He was saved not by scholarly debates, but by saved lives. Soldiers he treated on the battlefield returned home. Nobles whose wounds he healed were alive. His reputation grew, spreading from battalions to royal courts. The kings of France, whose lives depended on effective physicians, saw the difference. Henry II, Francis II, Charles IX, and later Henry III, all chose Ambroise Paré as their personal surgeon. The royal court was a place where real results, not university diplomas, were valued. When the monarch's life was at stake, dogmas took a back seat. Kings needed someone who could stop bleeding, heal wounds, and alleviate suffering, and Paré did just that when others helplessly threw up their hands. His talent and practical genius became his shield. Protected by the crown, he was untouchable. He continued to operate, write, and teach, ignoring the angry philippics of the academics. This confrontation between armchair science and practical experience, between ancient dogma and tangible results, determined his fate. The faculty never recognized him as an equal, but his patients, including four monarchs, recognized him as a genius. It was this powerful support that allowed the self-taught barber-surgeon to withstand the fight against all medical orthodoxy and pave the way for a new, effective surgery. Royal protection was a powerful shield, but for full recognition of his methods, Ambroise Paré needed more than the favor of monarchs. He needed to break the invisible barrier separating barber-surgeons from true surgeons, members of the Parisian Corporation of Surgeons, known as the Collège Saint-Côme. This was not a university but an influential guild whose authority in the world of practical medicine was undeniable. Joining it meant transitioning from a lower class to a higher one, from a craftsman to a master, and for this, one had to pass not only an examination, but also present a dissertation, in Latin. Paré, a man without a university degree, without knowledge of ancient languages, faced his final, decisive test. His opponents at the medical faculty gloated. They were certain a self-taught man, accustomed to working with his hands, would never overcome academic hurdles. After all, knowledge of Latin and Greek was not just a requirement but a symbol of their elitism, their exclusive right to truth. But Ambroise Paré, as always, thought differently. He understood perfectly that his strength lay in practical experience and clarity of exposition. He applied for admission to the Collège Saint-Côme. It was an audacious move. In 1554, after years of working in the field and in royal palaces, he appeared before the strict examiners. And he did the unthinkable. He refused to write his dissertation in Latin. Instead, he presented it in French. This was not just a linguistic choice, it was a manifesto. Paré challenged the entire system that used Latin as a tool to conceal knowledge from those who needed it most, from thousands of practicing barber surgeons, from soldiers on the battlefield, from common people. His dissertation, dedicated to the treatment of wounds and fractures, was written in simple, accessible language, full of specific observations and practical recommendations. It was not merely an academic work, but a guide to action. The examiners of the Collège Saint-Côme found themselves in a difficult position. They could not deny his practical successes. He was the king's personal surgeon. His methods saved lives when their own dogmas led to death. And despite the indignant protests of the Paris Faculty of Medicine, which continued to brand Paré as ignorant and a heretic, the Collège Saint-Côme made an unprecedented decision. They accepted his dissertation. They recognized his knowledge. They recognized him as a master. On that day, Ambroise Paré officially became a member of the Collège Saint-Côme, receiving the title of Master Surgeon. This was not just a title. It was a seal of legitimacy that no academic attacks could obscure. The outcast they had called him was no more. He had transformed into a recognized leader whose methods, based on observation and results, now held official status. His triumph was the triumph of practical reason over blind dogma. He proved that true science is born not in dusty treatises, but in the hands of those who confront reality face to face. Paré's recognition as a master surgeon was not merely a personal victory. It signaled systemic changes that slowly but inexorably transformed the very essence of surgery. On battlefields and in hospitals, the barbaric practice of cauterizing wounds ceased. Boiling oil and red-hot irons, these instruments of torture, became relics of the past. Wounds were now treated with soft balms, meticulously cleaned rather than burned. This rejection of cruelty not only radically reduced the unbearable pain patients endured, but also dramatically decreased the risk of gangrene and fatal sepsis, which had previously been almost inevitable. Soldiers with gunshot wounds now had a real chance of survival, rather than a torturous death from infection. The tying of arteries, or ligature, replaced amputation as the primary method for stopping bleeding. This was a revolution. Before Paré, a severed artery almost always meant the loss of a limb or rapid death from blood loss. Now, thousands of soldiers and civilians preserved their arms and legs, which would have previously been mercilessly severed. Each limb saved was not just a statistic. It was restored ability to work, the chance to live a full life. In hospitals, where mortality from post-operative complications once reached horrifying levels, a significant reduction in fatalities was observed. Patients whose wounds were treated with Paré's methods suffered less from shock, and their recovery was faster, with fewer suppurations. Clean healing wounds became the norm, not the exception. His self-created anatomical atlas became a foundational textbook for future generations of surgeons. It laid the groundwork for a deeper, more visual understanding of the human body, a fundamental departure from blindly repeating ancient errors toward studying real anatomy through dissection and observation. The publication of his works in French, unprecedented for its time, broke a centuries-old language barrier. Medical knowledge ceased to be the privilege of a narrow circle of Latin scholars. Now, hundreds, then thousands, of barber-surgeons, apothecaries, and practicing physicians who lacked university education could study them. This paved the way for the widespread dissemination of new, effective methods, accelerating their implementation across Europe. The authority of barber-surgeons began to rise rapidly. From a lower class performing dirty work, they gradually transformed into respected specialists, capable of saving lives. This altered the structure of medical hierarchy, elevating the status of practitioners over theorists, and laying the groundwork for future medical schools where practical experience was valued equally with book knowledge. Paré's influence was not just theoretical reflection, it was measurable, tangible. It manifested in saved lives, preserved limbs, significantly reduced mortality, and a new approach to education. He didn't just reform surgery, he made it a science based on evidence, not dogmas. This was his real, tangible legacy, the foundation upon which all modern medicine would be built. This is the paradox of his legacy. Not a learned doctor, but a simple, Latinless barber-surgeon, overturned centuries of beliefs. Ambroise Paré did not rely on the authority of ancient texts. His only textbook was the reality of the battlefield and hospital wards. He did not seek the approval of elites, but trusted his own eyes and the results. His revolution lay not in inventing complex theories, but in a simple, yet previously unthinkable, idea. Medicine should alleviate suffering, not multiply it. He proved that true science is not a collection of inviolable dogmas, but a continuous quest based on observation, logic, and compassion. His life is a living testament. The greatest breakthroughs often come not from academic offices, but from those who dare to ask a simple question: does this work?